I'm out. I am here.
We live around here.
Well, we get up here.
Well, I could get one for my mom. If
Yes,
that's okay.
absolutely. Because she knows a little about this. And also the Women's Commission. This saves lives because we provide life-saving treatment for life-threatening illnesses. If they need us and don't have insurance. So you might want to make sure you take that home to her. And she might be interested in the Women's Commission as well. I'm glad you stopped in.
Thank you.
You're welcome. Good. That was a good day.
Come and join us, we'll take you on a
Good evening, everybody. We're going to go ahead and start.
14.
I'd like to say hello and thank you all for being here, for allowing us to come and to listen to you and your questions and your concerns. This is the second stop of this year's Herbert Henderson Office of Minority Affairs listening tours. The way that these listening tours go is that I will introduce the number of representatives who have come with me here from the Capitol. They will come up and each introduce themselves. They will explain what they do, what their agency does, and after we hear from each one of them, I will open up the floor to questions. You may give comments, you may give questions on any particular subject that you'd like to talk about. So before we go on, I would like everyone to take a look at the screen for a message from our governor.
Hello, I'm Governor Jim Justice. Thank you for attending today's listening tour being hosted by the Herbert Henderson Office of Minority Affairs. While you're here, I hope you'll explore the many state and federal resources that we have available to you and your family. And please feel free to speak to our representatives. Call my office about any questions or concerns that you may have. Let's work together to continue to achieve equality for all West Virginians. Today's event is an opportunity for you to bring your problems forward so that we can find solutions to those problems. Again, thank you for coming, and thank you for making your voices heard.
Thank you. So before I start bringing people up to speak, I would like to recognize our distinguished guests or guest. So if I miss anyone, please let me know. I do see that we have among us West Virginia's very first African-American commander of the West Virginia Air National Guard. We have General LaDonna Walker. And we also have with us the Air National Guard table over there. So as we go through tonight's events, we've got Tony over there. So feel free to go and have a word with him. First up, we're going to hear from the Governor's Director of Constituent Services. Please help me welcome Director Jason Williams.
Thank you. Good evening. Again, my name is Jason Williams, and I'm Director of Constituent Services for Governor Jim Justice. And in the Governor's office as a whole, we have different divisions or different sections of the Governor's office that do different things. For instance, we have our press office, we have our Office of Communications, we have those that deal with policy, those that deal with legislation, we have General Counsel, that's our Governor's legal division, and then you have Constituent Services. And in our office, we do a number of things, we provide a number of services, but we primarily function as a liaison between the citizens of West Virginia and state agencies. So people contact the governor's office about anything and everything you can possibly imagine. They contact us by phone, by mail, by email. They walk into the governor's office, and they have a particular problem or issue that they bring to our office, and we try to assist them in any way that we can. That doesn't mean that they always get a positive answer, but sometimes people are coming to the governor's office just for information. Sometimes they come to us as a last resort. They don't know where to go to get certain information. Some people call us the complaints department. Sometimes we're information and referral. But anytime somebody comes to our office, we try to help them in any way that we can. We deal with every state agency, every section up under each agency. And I'm going to have a table back here tonight. I'll be here during the event to answer any questions that I can. And afterwards, if you have a particular problem that you want to share with me, I'll try to assist in any way that I can. Thank you.
Thank you, Director Williams. So next up, we're going to hear from the West Virginia Women's Commission and Catastrophic Illness Commission, Ms. Julie Pallas.
Hello, everyone. I think I've talked to almost everybody, so I'll be as brief as I can. This West Virginia Women's Commission and the Catastrophic Illness Commission table is over here, so if you didn't get a chance to get our brochures, I'm going to tell you a little bit about them really quickly. This tells you who we are and what we can do, and also we are trying very desperately to make sure that anybody that wants to be involved in the Women's Commission or in women's activities or want to tell us about their concerns for women in the state will let us know. Our information, of course, is on the back. The other commission is the Catastrophic Illness Commission, and these, if you only take, probably my phone, if you only take 2 brochures for me tonight, take this flyer and this brochure, because we provide life-saving treatment for people with life-threatening illnesses once all other resources are exhausted. So if you're denied Medicaid and you don't have insurance, all they have to do, you, friend, maybe a family member, they just call us on the phone and we'll see if they qualify just taking the application over the phone. So it's very important to us that everyone at least take this and keep it where you know it is, so that nobody goes without getting the help they need if we can help them. It's no cost to them at all. Of course, there's certain criteria, but we can go over that as well. This flyer, if you would please take at least one, we have a number of them, so you can take more than one, and put it up where you work, where you shop, where you worship, at your children's school, etc. Because it's very important. Not enough people know about this service, and we don't want anyone losing their lives here in West Virginia when we know that we could help them. Please come over and ask me questions if you have them. I'm glad you all are here.
Thank you. Next, we will get a double dose of state resources. Please welcome the Deputy of Military Affairs and Public Safety, Secretary Geoff Stanton. And along with Secretary Sandy, we'll hear from Deputy Chief Anthony Leonard.
On behalf of the Department of Military Affairs and Public Safety, thank all of you for coming tonight for this important event. The Department of Military Affairs and Public Safety in January of 17 had 13 agencies. And due to the great work from the governor, those agencies are now down to 7. We have done our best to eliminate duplication of duties. But one of the things in my time period I wanted to discuss with you was a program that we started last June. We kicked it off in Huntington, West Virginia, and that was a partnership with the Drug Enforcement Administration and DMAPS to outreach to every 5th through 12th grader in the state of West Virginia. Last week, we made a presentation to the middle and high schools in Williamstown, West Virginia, and Wood County. And after that, as a result, we now have reached out to over 38,000 kids in West Virginia. There is a brochure that I would appreciate. They're back at the governor's table. But on that, if you know of anyone that needs help, you know of anyone that you would like to try to steer away from being involved in drugs, it has a website and it has an email where you can contact that individual, or just go online and read the material, and it's excellent material. And some of the success stories from these 37,000 kids are amazing. Kids that wanted to bring their parents to come to the second session of the drug prevention training to hear what they had to say. And kids who were on drugs that stated, I need help. So these brochures, I handed them to some of you, but we want to help the young people. And obviously, we're the government, you trust us. Why would we want to do that? It's obvious. We want a 10-year plan to try to reduce young people breaking the law. When Governor Justice took office, the state had 9,800 individuals incarcerated. And due to the drug epidemic, the highest number of incarcerated people in the history of West Virginia was in November of 18, with close to 12,000 people. We need to reduce demand, and by doing that, we need our young people to not want to go down that road. So anything that we can do to help you, I'll be here after the presentation tonight. I can give you my business card. We have some excellent people that have the ability to reach out to young people to tell them the dangers of drugs. And again, thank you all for coming tonight.
I want to thank y'all for letting me be the one to talk to you about this. About 29 years ago, I came up here from McDowell County. And I brought my 9-year-old, and he's back there right now. He works for juvenile. I went through South Central Regional Jail. I was CO1, now I'm deputy chief. And it's like it's come full circle now, because y'all accepted me in y'all's community, and I get to come, and hopefully, when this is over, y'all will see that I have a lot to offer the young people, which would be the opportunity to have a career. A lot of people look at the jail and say, oh, I couldn't do that. But all it is us trying to take care of us. Because everybody in jail is somebody's son or daughter. And it could be your neighbor. Actually, my neighbor has me now. And anybody can come to jail, but we can stop people from coming back. And that's the problem we have right now. So many people come back. I've been working for 26 years, and just today in the medical department, one of the guys that I met when I started, I was at the Kanawha County Jail, and he said, I've been doing 30 years in installments. We can stop that. But we have to get, like Mrs. Sandy just said, while they're young. And we need to quit turning our backs on the old ones. So, if nothing else, I'll be at the table back there, and if you can get me a little group of people, big group of people, Mrs. Sandy has gave me the right to come talk to them. I'll talk to anybody. If you got a child that's having a problem, I'm pretty good at talking to them. I'm also a Dunbar coach for the youth football team. So I'm used to the little ones too. So when this is over, I hope someone comes to me and tells me they got a group they want me to talk to. And thank you for the opportunity.
Thank you for that, Deputy Leonard. Next up, we're going to have from the West Virginia Community and Technical College System, Ms. Nancy Lycus.
I'm tired now, so. Hey everybody, thanks so much for coming. As I said to Joe earlier, this is my first gig on the listening tour, so glad you all made it and have an opportunity to bring the community college system to you tonight. So I am the Director of Workforce and Economic Development for the state system of community colleges. Our office is right here in Charleston, or right down the road in Charleston, I should say. And for those who aren't familiar with the community college system here, there are 9 community colleges in the state of West Virginia. We have about 27 campuses, and we are divided regionally, so all of our colleges have a cluster of counties that they're responsible for, and we work as a system to share curriculum, share ideas, share opportunities, and work with people throughout the state of West Virginia. So my primary role is really twofold. I am the person at the state system who works with business and industry partners across the state to identify opportunities for our colleges to offer the right training and the right education in our community colleges for people to get the skills they need to get great jobs in West Virginia. So I am that person that meets business partners, new people through the Department of Commerce, people who want to move their companies to West Virginia and bring that back to our community college system throughout the state. I'm also the person who works on behalf of any of the students. And when I say students, many of you might even not realize that in our community colleges, the average age of our students is about 27, 28. So that is a range between 18-year-olds and 40-year-olds really, but we're not age discriminatory, Sonia. So come back to community college, everybody, in this room, because we've got a program for you and probably a good job on the other side. And that's really the point. The point is that you are our stakeholders, our communities, and our business partners, and we develop our programs and our curriculum around those stakeholders because, in the end, it's about the economic vitality of the state of West Virginia. So we're providing the right skills to train and educate people in West Virginia to be able to work in the employment opportunities that are here and bring those good jobs into West Virginia, keep our employers in West Virginia, grow those businesses, grow our economy, and that's really the mission of the community college system. So tonight I've got a bunch of handouts at my table and over there next to the AARP table. So if you have any questions for me, I know a lot of people are asking tonight about the new West Virginia Invest grant that was passed through the legislation this session, and I'd be happy to talk to everybody about that, so come on over to the table. I've got a handout for that. I've also got our program study guide, which is a great piece of literature that can show you what we do all over the state. And also, if there's any employers in the room, I'd be happy to talk to you about opportunities that you can put our students to work. So thanks again for attending, and I hope to speak to all of you tonight. Thank you.
Thank you. Next up, please welcome from the Office of Minority Health, Ms. LaDonna Walker.
Hello, everyone. Hope everyone's doing well today. Thank you to Ms. Upson for inviting me to come on a listening tour. This is the second tour, and it started off really well. So I will briefly explain to you guys about the Office of Minority Health. I know sometimes it can be repetitive for the ones that were at the first listening tour, but the Bureau established the Office of Minority Health in 2013 with the mission to eliminate health disparities for vulnerable populations as defined by race, ethnicity, socioeconomic status, geography, age, disability status, and other populations identified to be at risk for health disparities. As we know, African Americans and minorities, we burden the health burdens in West Virginia at large numbers. African American males, they are actually developing diabetes type 2 specifically, and they're dying. So one of the goals for me to do is to research these diseases and find grants to fund programs, which we know preventative is the key. If we can prevent people from developing type 2, then we can actually eliminate some of the statistics that go with type 2 diabetes. So basically, my job is to coordinate statewide efforts to reduce health inequity for vulnerable populations as defined by race, like I said before. One of the main goals is to collaborate with the governor's office of Minority Affairs to facilitate adequate accessibility to necessary programs and health services for defined vulnerable minority populations within the state, because my office can't do it alone. We need the funding, in which the Office of Minority Health, for those who don't know, the main location was in Charleston, West Virginia, at the Bureau of Public Health. So they met with Dr. Anthony Ward around June, and they developed kind of a contract, and they moved the Office of Minority Health from Charleston to Huntington on Marshall University's campus, where we can receive more resources and more support that way. So another thing is basically, like I said before, it is a difficult time in West Virginia. African Americans, minorities, like I said before, are developing diseases like obesity. I did some statistics on obesity a while ago, and the numbers were very, very high. Once again, it's a preventative thing for obesity. So keep that in mind too, that if we research and we can educate, we can start, like the man said before, start while they're young, then we can prevent some of these diseases from occurring. So another thing that I want to address is the College of Health Professions, the Department of Public Health. That is where the Minority Health Institute, which was founded by Dr. Ward. One of the things I want to kind of inform the community and public is that department is chaired and professored by an African American at Marshall University. And it is a good program. We want to get as many African Americans and minorities to join that department of masters. It's a master's degree. And also, I want to also inform you guys, there's no requirement, there's no GRE requirement for that Department of Public Health. So if you all have any more questions, feel free to come back. My table is in the back if you have any more questions, and thank you.
Next up, from the West Virginia Department of Agriculture is Mr. Bruce Murphy.
Thank you, Jill. It's really not that far. I'm really not that slow. It's just a long way from up here. Could be a long time to get up here. My name is Bruce Murphy, and I'm with the West Virginia Department of Agriculture. I'm a special programs coordinator with the business development. Also do veterans agriculture program with that. So if there's any veterans or service people in the room, I'd like to take this time to personally thank you for your service. One thing with the Veterans to Agriculture program, our main goal is to recruit veterans, we retrain veterans, and then we mentor veterans in the agriculture field. One of the programs we're actually doing right now is actually working with the Herschel Woody Williams Medical Center in Huntington, and we have a therapeutic agriculture program, and that's basically trying to get veterans out of the hospital into the field, trying to work with them and trying to get them to do more things, more physical things, and actually trying to get them trained in agriculture so they can be a little bit more benefit to society and where they can really get out and increase their quality of life. We also work with minorities, women, and displaced workers. So with that, we're really about agriculture. We're really about trying to establish the next generation of farmers in West Virginia. West Virginia is dead last in agriculture, as a matter of fact, so that's why we're putting a big emphasis on that. So I have a very rewarding and unique job. I get to go out and travel around in the communities, around in the state, and do a variety of activities from planting small orchards to working with senior citizens to doing greenhouses with them and community gardens. So we have a very big program ahead of us as far as trying to grow the next generation of farmers and everything. So if anyone would like to talk with me, I'll be back in my post right here, and I hope you enjoy the evening.
Thank you. Next up, we're going to hear from the Bureau of Public Health, Director Bruce Adkins.
We're getting our Bruces taken care of here. As a matter of fact, I have to say this about my friend Bruce. We've been good friends for years, but we have not seen each other for about 2 years. So here we are. My name is Bruce Adkins. I am the director of one of the offices of the Bureau for Public Health. You've met LaDonna, so you're meeting a couple office directors. Our health commissioner and state health officer, Kathy Slim, who has been on board for a couple of months now officially, interim for a while. Sends her regrets she could not be here. I believe she's in DC. I'm not real sure what she's doing there, but anyway, she definitely is going to be very involved with the efforts of minority health and other things. We've got to get her acclimated and going. The Bureau for Public Health, it has a simple mission, but it has a daunting task with 16 offices within the Bureau. Simply, the mission is for the Public Health Department to work with people, families, partners, communities to help and achieve advancement of safety and health. Sounds easy, very difficult task, as we all know in our state. So the vision is healthy people in healthy communities. Again, sounds easy, daunting task. The Bureau has multiple offices in it. I'm going to run through them just real quickly. Office of the Chief Medical Examiner. Pretty much everybody understands the Chief Medical Examiner's duties, especially with the substance abuse and drug abuse that we've got going on. Unfortunately, they're one of the busiest Chief Medical Examiner's offices in the country. Office of Community Health Systems and Health Promotion, which is the office that I help to run. It has minority health, health promotion, chronic disease, cancer, things that come from tobacco use, diabetes, etc. Community health, which again is out in the community, out in the rural areas, and in primary health centers and what we call look-alike health centers. Those all are funded in multiple ways, state, federal, local, to advance health in the local areas. Office of Chief Medical Services, that's EMS, that's your ambulance services and all things emergent at the local and state level. Epidemiology and prevention services, that's immunizations, that's vaccinations, that's taking care of health outbreaks, things along those lines. We have a health statistics center. If you do anything in health, you have statistics. Some of them are bad, some of them are good, but we have a team of epidemiologists and others who get that information out to you. Also, laboratory services, they take care of diseases, illnesses. The state lab also houses some of the folks that are taking care of all of the medical issues, autopsies, things like that. Office of Maternal Child Family Health, that's women's, infants, and children's programs. Office of Nutrition Services, most people know it as WIC, Women's, Infants, and Children's Program, a massive statewide program. We have an office for privacy and informatics because we handle a lot of medical records, both those who have HIPAA issues and others that it's just data, but we have to continue taking care of all of that. Center for Performance Management and Systems Management, that's about accreditation, that's about state, maintaining state activities with grants, federal grants, etc. Center for Threat Preparedness, been in the news a lot lately. They handle all the disasters around the state and do a lot of other good things as well. Center for Local Health is about 49 local health departments within the state of West Virginia. There are some of the 55 states. There's one county health department that's a combination of multiple 5, and then there's a couple that are 2 counties put together. And last but not least, we have a Center for Public Health Finance, a massive task to take care of all the funding and all of the coordination of financing of that. So it has its own Center for Finance. So I'm going to stay around, and if there's any questions, I will try to steer you in the right place.
Thank you. Next, we're going to hear from the AARP. Please welcome Ms. Linda Bun.
Thank you, Director Upson. Good evening, everybody. My name is Linda Bun. I am the Associate State Director for AARP West Virginia. Maybe some of you have heard of AARP. Well, our mission is to help you live your best life. And what we want to do is give you the resources that you need to reach your dreams. So really, AARP is about you. It's about empowering you in countless ways, finding opportunities for service, for advocacy. The interesting thing, I love that this is a listening session so that we can hear from the community about what's important to you, because that's what AARP does with our 40 million members. We constantly turn to them for guidance so that we find out what's important to them, what's important to their families. And that's what guides us when we fight for things that we all want, whether it's consumer protections, affordable utility rates, financial security, fair treatment in the workplace, being able to live independently in your own home, even if you have health problems, protections against discriminations in the workplace, and to fight against frauds and scams. So this happens to be Financial Literacy Month. At our table, I have some very great collaterals for you to take that will help you and your family fight against frauds and scams and keep that nest egg that you've worked your lives for. So please come and visit. We have a wealth of resources, frauds and scams, caregiving, and volunteer opportunities. Thanks so much.
Thank you, Linda. And next, we're going to hear from West Virginia Women Work. Please welcome Misty Mayville.
Hello, everyone. Hope you are doing well this evening. My name is Misty Mayville. I'm the Program Manager for West Virginia Women Work. West Virginia Women Work runs Step Up for Women, which is a pre-apprenticeship training program in construction and manufacturing. We have 5 classrooms across the state. We have 3 construction located in Wheeling, Morgantown, and Charleston. And we have 2 advanced manufacturing programs in conjunction with Robert C. Byrd, and they are located in Huntington and Bridgeport. Our training is free. It is for females, and we help these ladies get out there and get jobs within inside 10 weeks and 12 weeks in our program. If you all have any questions whatsoever, I'm right there with my daughter, who I'm hoping one day will be a tradesperson and make more money than I do. If you've got any questions, she came in tonight, she's like, Mommy, can I go here? And I said, well, I'm still trying to pay them off. So we're going to get her to trade, and hopefully she'll be able to pay my student loan off. Thank you all.
Thank you. And last but not least, we have someone who has recently joined us on these listening tours. So this is his first stop. He is from the Legal Aid of West Virginia, the Financial Exploitation Division. Please welcome Attorney Kozlowski.
Thank you, Joe, and good evening, everyone. Having to play cleanup crew, I guess, but I'll try to make this short and brief for all of you. But just want to let everyone know that Legal Aid of West Virginia, we do exist. We have numerous offices throughout the state. Myself specifically, I work out of the Charleston office. We do offer a variety of legal services, everything from landlord-tenant to domestic violence and divorce to my expertise in financial exploitation. We do everything from brief advice all the way to even representing clients in court. So if you have questions about legal aid generally or specifically financial exploitation, I'm out in the corner right there. I got some information and I'm more happy to answer your questions. Thank you so much.
Okay, so now that everyone has had an opportunity to introduce themselves, here's the good part. We get to listen. So, as I said, everyone will be on hand for the rest of the evening if you prefer to speak with them at their tables, but for now, we're going to go ahead and open up the floor to questions. I would ask that anyone who asks a question allow for Michelle, our HHOMA Executive Assistant, to bring you a microphone. The same applies to our presenters. If you could please make your way to a microphone so that you are audible when the video is put out on the website. So, are there any questions?
Oh, I have several questions, but my first question is, essentially, what is the goal of this listening tour for your office?
So the goal is to bring the resources of state government to the community. So people often have a lot of questions and issues and don't necessarily know who to contact or what phone number to call or can't fit it in their schedule to drive to Charleston. And so the goal of this tour is to bring the resources that we have in the Capitol directly to the people.
You mentioned this is the second listening tour.
Yes.
When will your third one be? Because I would really like to invite more people. This is my first time coming. That way more people can come out and hear what information is available.
So we have been advertising. So we have 4 stops, actually 5 stops, because we've added a high school stop at the very end at Capitol High School. But our next stop will be in Piedmont. And then after that, we will finish up in the city of Branson in August. And so we started off in Huntington last month. And so we've used the traditional channels. We've used social media. We've used the newspaper. Michelle reaches out to local churches and asks people in the community if they could distribute flyers. And so we rely heavily on word of mouth. I was just speaking with Tony earlier how a lot of people just aren't on social media like you would think, even though we can reach a lot of people by running, the ads and the booths on social media. A lot of people, they aren't on social media. So I would appreciate if you could spread the word that we're having these events. Go ahead.
When will you be in Piedmont? Because I know of a church in the Piedmont area, and I would really love to send them information.
Okay, that is July. Is it July 13th or July? It's the second Tuesday in the month in July. So we will be posting that information on our Facebook page and on our Twitter page, and we always do a press release leading up to the event. So we try to get the information out there as much as we can. But yes, absolutely, anyone who can help spread the word, it really helps the community if they can come in and take advantage of this listening tour.
And actually our events for the year are on the website, minorityAffairs.wv.gov.
Any more questions for anyone?
I'd like to hear about the Office of Minority Affairs and what your goals are, what you want to accomplish.
Absolutely. So I came into this position this past December. And when I, actually even before I came into the job, when I interviewed for the job, I realized that the office had been underutilized. So it's been my goal since I've come in to expand the footprint of the Office of Minority Affairs, to have a greater impact in the community, and to serve as many people as we can. And so I've really tapped into a lot of resources and established a lot of really fruitful partnerships, not through just the listening tours, but you may know that prior to coming here, I was a legislator. And so the relationships that I developed those 4 years serving in the West Virginia House really helped me be in a position to where I can address a lot of issues for the community. But the goal is to definitely have a much bigger impact. And if you look at our calendar for the year, you'll see, if you look at the financial literacy classes that we started hosting, a lot of the cultural events that we've had, the Black History Month lecture series. So we're getting out into the community as much as we can, again, to have that bigger impact.
Just wondering, do you advocate for communities of color with the governor's office, with the governor directly? And I ask that because I reside in this area. It's a historically Black community, the Institute Pinewood West Dunbar community. And it's also an unincorporated area. So we consider ourselves, unfortunately, to be very marginalized with regard to our voice and trying to get our needs met. Case in point, we have a recreation, a golf course that was transitioned into a multi-sports complex. And there are issues regarding traffic. There's never been a traffic study done there. We've had issues in terms of being able, for our community residents to be able to access that on a sliding scale or with reduced fees. This is a very underemployed area. And so there are things like that, that come across our sewer systems. We're paying the highest rates for sewer in the whole state. And as a result, people want to move because they can't afford the basic utilities. And so there are a lot of things like that that are happening in our community. A lot of it's economically driven. And I'm wondering what voice you can give for us with the governor. And certainly I'll appreciate any conversation we can have, outside of this. But just what is your perspective about your role in advocating for communities of color?
Well, that's exactly what this is, and I see the Director of Constituent Services, writing down as quickly as you can get the words out so that he can take all of this back to the governor. But that's absolutely not only what I do, but what everyone here is hoping to do, is to be able to be that voice for you back in the Capitol to address those specific issues. And I, having worked with Director Williams, I know that he will follow up on those items of concern that you have named.
I'm Rick Martin, president of the Charleston branch and the ACP, and just a little bit of a history lesson, because while I commend the effort of the HOMA office in getting out with these listening tours, historically speaking, I think I would like for all of you to avail yourself of the opportunity to look at Google through the West Virginia Legislature's website, House Bill 4015, 4015. That's the bill that created the Herbert Henderson Office of Minority Affairs. And the history goes back to around 2003 with the Legislative Select Committee on Minority Issues. They issued a 365-page report containing 23 legislative findings and 36 recommendations. 23 legislative findings, 36 recommendations. Little has happened in almost 15 years to advance and deal with many of the recommendations that were contained in that report. That report was broken down into areas such as criminal justice, education, healthcare, economic development, employment, business development, housing, community and family services, and the list goes on. I think it's extremely important that Ms. Upson, you and other state agencies receive input from the community. But at the same time, I think it is equally important that the community hears from you. What are the issues that you have identified in conjunction with your collaborative team within state government? You become, in many respects, the people's voice. A lot of times we don't know what we need. Sir, let me grab my note because I don't want to call you out of your name. Mr. Adkins, Public Health. In Huntington, I made mention of the fact that a Newsweek article that was recently released, I think it was October of 17, identified the top 50 cities, locations in the country with the lowest life expectancy. West Virginia had 5 on that list. One right in the shadow of the state capitol, the west side of Charleston. Another was West Huntington, Logan, Salem, and there was another one more. Hinton. We need a health summit so that the people can hear what is the Bureau of Public Health doing? What is the strategic plan? You know, we talk about jobs and education. The lady back here from the community college. You know, how will education be connected with employment? We need to hear about those types of things. Criminal Justice Secretary Sandy, wonderful presentation. He's provided us with information that we've disseminated now through some of our local branches as it relates to the employment opportunities and career opportunities in criminal justice. Jason, Constituent Services, we appreciate you. We hope you're taking these notes because I really am of the opinion that we need to hear what is the plan from state government. We got a piece of legislation, 2724, it's been underway for a couple of years. It was a governor's bill. It was to have identified a pilot demonstration project to address poverty and substance abuse and other social determinants of health. It's languished for 2 years, while our people, particularly people of color, continue to suffer. Again, in the shadow of the Capitol. The west side of Charleston's been designated slum and blight. It's been designated a drug marketing intervention zone. It's been designated as an area high with health issues that affect, and poverty that affects the local residents. Yet there is no plan moving forward that we are aware of We've presented plans with no response, but government is not coming to rescue us. And unfortunately, it feels like our attempts to capture the attention of state government is not advancing very well. So again, I appreciate all that you've said, but I think folks representing the Charleston branch of the NAACP, I tell you what I'm looking for. I'm looking for some accountability. I'm looking for some transparency. The Select Committee on Minority Affairs, I've written to the Senate President, I've written to the Speaker of the House. We're laying out some expectations. And you know, let's face it, guys, 2020 is an election year. And before too long, the people of color are going to be asked to support a candidate. Well, we want your vote. Well, what are we getting in exchange for the vote? So these are things that we intend to make the administration and the agencies aware of. If now is the time, if not now, when, and I appreciate the opportunity to express my feelings, thoughts, ideas, Jason, and I hope you will take those back, and Director Upson, I look forward to working with you. We want to be an ally. We want to help you advance the priorities of your office, but we are asking as respectfully as we can, please hear us.
Thank you for your thoughts, and I will say that everyone here, we're all here for that reason, because we do want to hear from the community, and I know that the gentleman touched on a lot of different points, but for those who aren't aware of what happened with the House bill, which is now named the Bridge Program, it stands for Building Resources in Diverse Geographic Environments. Since I've come into this position, I've taken over that project and have gotten a commitment from the governor that it will be funded. So it's my understanding that the project did not move for 2 years because there was no funding to make that happen. So that has all changed. And so I appreciate your points, and we'll take any additional questions.
Not to editorialize Mr. Martin, our president's comments, but when he talked about the Select Committee report, he kind of based in 5 different areas. And I guess what I'm trying to take from a listening focus forum to an action forum to deal with education, health, workforce, and economic development, as well as juvenile and adult criminal justice and racial profiling. And when the original Select Committee issued its report, a couple things came out. And in education, there was a closing achievement cap bill. Right now, we're still fighting to see activity in the area of expulsion and suspension, because we see the statistics are getting out of hand again for minorities, and the rates are getting kicked out of school. Health, the Office of Minority Health, but we also tried to get a bill passed recently dealing with the Minority Health Advisory Task Force to address the social determinants of health. That was Senate Bill 573, and there was a House bill similar to that, 2153, that did not get passed. Again, we're still advocating for those. Workforce and economic development, we know what workforce, and is it in the Office of Improvement, whatever it is, excuse me for not knowing the acronym, but basically the federal law and the state law are now in writing to increase our workforce development, and still, statistically, we think it's worse than it was in 2003. The workforce in West Virginia is probably 10% or maybe even lower than that of the national average. I think we're averaging, 45% workforce, and that's including those who are on unemployment. So we still need to address those issues, which means in our community, it's going to be a worst case scenario. We're not going to have people who are going to be able to pay for my Social Security, because I'm trying to collect it. I need my check coming in once a month. I'm not allowed to, that's not a laughing matter, that's a serious matter. And I got 6 kids, so I'm hoping they keep their jobs for a while. Juvenile, 60 and 70 is huge. I'm losing count of kids. Getting old. Juvenile and adult criminal justice. There's a new term out there, disproportionate minority contact, where people of color are being approached and broached by police officers and law enforcement at an unreasonable rate, not necessarily that they haven't committed any more crimes, but they are being stopped, and that has to do with a racial profiling study done by Dr. Stephen Haas. And again, we're trying to address those issues. And again, the only thing I would say is not to you, and it's not to your office, but that's the issue that when people in West Virginia are told to, if they have a problem, to come see, go see Herbert, Henderson, Office of Minority Affairs. These are West Virginia problems. They're not minority problems when you talk about education. You talk about juvenile and adult justice. When you talk about education and workforce development. These aren't minority problems. They shouldn't be just laid in your lap just because an African American came up with the idea or recommendation for a suggestion. So we're saying the current solution in the bill recently passed has ways to address it, and that's by getting legislature up off their seats and actually working select committee issues and addressing it and providing a report and recommendations, and again, legislating as they should for bills to create jobs, create better education plans, create a better adult and juvenile justice system. So again, we're not only, we know it's not just your burden alone. We do want to be allies in this occasion, but we need legislative champions to listen to our voice.
Thank you. Does anyone else have any questions or comments? Oh, there she is.
I'm sorry, I just have a lot of questions. I do want to circle back with this bridge project. You said it was funded, and can you tell me how the funds are utilized and how that works within that office or that project, and how much money is in that kitty?
So the first phase of the project will be specifically to the west side of Charleston. The funding is for a total of $250,000. Community-based nonprofits will be able to apply for grants if they are able to demonstrate that they are addressing or have a plan to address one of those social determinants of health as called for in the bill. Each individual grant is capped at $25,000. Now that doesn't mean that a nonprofit could not apply for more than one grant. If they are addressing more than one component of the bridge program, they would certainly be able to do that. The funds will be administered by the Community and Development Office located under the Secretary of Commerce.
And what are those components?
We have economic stability, I don't have it in front of me, economic stability, healthcare, which would include things like mental health. We have community living. We also have things like community light, and there's one more that I'm leaving out, education.
Is there a set aside for nonprofits that are run by persons of color?
Well, the nonprofits, the mandatories for this project are that they address the west side of Charleston. So
that's the first phase, though.
Pardon me?
That's the first phase.
Right. Yes, correct.
So subsequent to that.
No, there is no. If there, is there a community nonprofit who's working on the west side and can demonstrate that they are addressing, whatever their component is, if they're, going to do a splash park or whatever the case may be, they would be able to qualify for that grant. There will be a review board that will look at it and determine whether or not that would be an appropriate use for the bridge program.
When will phase 2 start, and what does that entail? Do you know?
We don't have a start date on the phase 2 portion. I've already had meetings with the university and the Eastern Panhandle about phase 2, but we do not have a start date. on that. We did have a stakeholder meeting scheduled for phase 1, but I had neglected to look at the calendar, and so I scheduled it for the day before the last day of the legislative session. So needless to say, the people that were involved in the governor's office suggested that I pull it off the calendar so that we could do it when things weren't so chaotic.
Will phase 2 be specific to the west side as well?
No, phase 2 will be up in the Berkeley and Jefferson County area.
So has a new date been established for the stakeholder meeting and then the public announcement and launch?
Right, so all of that rolls out at the same time, and I know that we talked about that on Saturday when I addressed the members of the NAACP in Lewisburg, but for everyone else, we are working on the logistics of having it set up as a public meeting so that anyone who wanted to come, anyone who wanted to watch it via live stream could be able to do that. And I always talk about how I love the communications team from the governor's office. They do a fantastic job, but we do have to share them with the governor. And so as events come up that take precedence, I do have to work logistically to schedule those dates, which I am working on now.
And just my last question, I think that it is. How many state employees identify as persons of color? If you know the exact number or at least the percentage?
I do not know the exact number of people who, state employees who self-identify as minorities that are persons of color. I don't know if some of the agency heads who are here has information on their particular agency, but that is a challenge. And I know when I've spoken with the Secretary of State's office, because I was trying to compile a list of minority businesses, and he explained to me that that is a challenge, that you're relying on people who are going to self-identify, and not a lot of people, not everyone, would feel comfortable listing themselves as a minority business or person of color for whatever reason. So no, I don't have that information, I'm sorry. We can look into it though to see.
It's hard to get that information for women as well.
Yeah.
Director, can you repeat the BRIDGE acronym?
Building resources in diverse geographic environments. All right, so those were some great questions. Before we move into the raffling off of prizes, does anyone else have a comment or a question for me or for anyone who is here?
Oh, one last point. I promise it'll only take a minute.
Just a moment. Let me get it up to you.
I promise it'll only take a minute. But I'd like you to give us some thought to something. This education stuff and the special session that's going on as it relates to the legislature and what they'll be dealing with. We have an idea that we'd like to see considered and would like to give you some information on it, because we believe that there may be an option to charter schools, or at least something that can be considered. Something's got to give, Director Upson. I mean, education reform is needed, and I'll hold out the example for you at Mary C. Snow Westside Elementary, an excellent school, a beautiful edifice. But the children over there, we are losing generation after generation after generation. They have ranked no higher than 5th from the bottom of all the elementary schools in the state. There is a need for some education reform. And I don't know what the legislature is going to end up with, but from the minority community, we're saying to your office, being an office for us, if you will, we'd like you to consider an idea that we have, and we would like for you to at least consider brokering that idea on our behalf. And I'll be more than happy to talk to you more about that, but I wanted to capture that for the record as well. We're losing our children. And while all of this rancor is going back and forth about charter schools, no charter school, education reform, we're losing every day. So we got an idea.
Okay, thank you. And I look forward to speaking with you about that. And I will say that I agree. And when I was in the legislature and you'd have committees say, oh, well, let's put it into a study for a year. I would argue that, 1 year is a long time in the life of a child when you're talking about education. And so I agree that there is absolutely a sense of urgency in dealing with education. Okay, so with that, I am going to bring Michelle Petties up, and she is going to raffle off some prizes. Did everyone fill out a raffle ticket?
Yes, does everyone have a raffle? This will be your last chance for the red tickets.
Need one? Raise your hand if you need one, we'll bring them to you.
Okay.
Give me that over here.
Any others? Oh, oh no.
We had somebody this morning just couldn't find it at all, so don't feel bad. Everybody else? You need last chance. Anybody else want? Good try.
Okay, all right, we're going to get started with the first item. We have a book by West Virginia native Morris Morrison. It's called Overnight Success, and if you have not heard him, be sure to check him out on YouTube. He is a dynamic motivational speaker, all right? So we're going to go ahead and draw. All right, Julie, pull that ticket. And the last four are 3478. 3478.
Rick Martin, you should have it. You pulled the ticket right for me. I got 79.
That might have been the one that.
You got it? All right.
That's a great book. Great book.
Thank you, Reverend Watts. Awesome. All right, and our next item we have is a CD entitled That's Life by West Virginia's very own Landau Eugene Murphy. All right, go ahead and pull that ticket, Julie. 3480. What? All right, thank you.
All right, who wants that last one? Look at me and let me see if I can get the number.
All right, the last item. All right, these are brand new for us. It's kind of cool, right? It's a drinking cup, but the best feature with this cup is one, that it has HOMA's information, so you know how to contact us, right? Social media, website, phone number, but also it has a built-in pill dispenser.
Isn't that cool?
How cool is that, right? All right, Julie, go ahead and pull that ticket. 3475. 3475. Oh my.
That might have been the one you lost.
Nobody? Nobody? All right, we're going to pull another. Go for it, Julie. 3476. That's you? In the back, are we sure? Okay, I'll come to you. Awesome. And what's your name? Pam. Thank you so much. Now, I just want to, one more thing. On every seat, in the seat that you're sitting in, you should have seen a feedback form, right? Just a quick survey. We'd appreciate if you could fill that out, and then on your way out, drop it off at the registration table where you signed up when you came in. And also, we just want to say thank you for coming out. There is food in the center of the room. Grab a plate, light refreshments, bottled water in the tub.
Yes, and I also want to remind everyone that I and the rest of our presenters will be on hand for another few more minutes, and so please feel free to come up and continue the conversation with us. Thank you.